is the topic for this video, and the best way to explain it is with a scenario. So you have a pregnant woman who, during or after delivery of her baby, so essentially the postpartum period, has excessive blood loss. Now this reduced blood flow results in ischemia to the pituitary gland. So the pituitary gland is at the heart of Sheehan Syndrome. Reduced blood flow results in reduced oxygen to the cells of the pituitary gland, and this will affect the function of that endocrine gland. So essentially you can think of Sheehan syndrome as maternal hypopituitarism. And let's take a look at the pituitary gland. Where is it? So here's a very nice image of the brain, and the pituitary gland is right here. You can see the arrow pointing to that lobe, and right above the pituitary gland is a very important endocrine gland known as the hypothalamus. The pituitary gland cells become damaged, or they can also undergo necrosis, and this reduces the pituitary gland function. Now keep in mind that these problems can be acute or they can be chronic. They can happen immediately, or the symptoms can manifest themselves months or maybe even a year or two later. Let's talk about the symptoms now. To illustrate the symptoms, it's important to first understand what are the hormones that are affected. The hormones of the pituitary gland, in particular the anterior pituitary, can be summarized with a mnemonic, and that mnemonic is flat pig. F stands for FSH, L stands for LH, A stands for ACTH, T stands for TSH, P is for prolactin, and G is for growth hormone, and the I doesn't stand for anything. So first let's discuss what these hormones do, and then you can get a better understanding of what will happen in the body if these hormones are no longer produced in sufficient quantities. So FSH and LH, among many things, is involved in the function of the ovaries and reproduction. ACTH does many things. It stimulates the adrenal gland to produce its own hormones that do many things in the body, like regulate blood pressure. TSH stimulates the thyroid gland. Prolactin helps with lactation. And growth hormone, of course, is involved with many things such as muscle strength and various other things. So now, if these hormones are not being produced in sufficient quantities, what would be some of the symptomatology? Problems with FSH and LH production would lead to amenorrhea, menstruation problems, and can also lead to decreased libido. ACTH deficiency can lead to low blood pressure, also known as hypotension. Hypothyroidism can result if your TSH is not produced in sufficient quantities, and that can of course lead to many of the symptoms of hypothyroidism, which include fatigue, weight gain. Prolactin not produced properly results in failure of lactation. So essentially, the woman is unable to breastfeed. Lack of growth hormone can lead to many things. I'll just mention one: loss of muscle strength. The most common of these symptoms in someone with Sheehan syndrome is this one right here. Failure of lactation, inability to breastfeed. Diagnosis involves measuring the blood pressure because hypotension is very common, and of course you would have to measure the hormone levels to see that they are low, meaning not being produced in sufficient quantities. Treatment of Sheehan syndrome involves hormone replacement as follows. To deal with the FSH and LH deficiency, you give estrogen and progesterone. Prednisone is generally used to replace ACTH. And thyroxine is used to deal with the low TSH. And these are the main hormones that are used to treat Sheehan syndrome. So let's take a look at a few clinical vignettes. A 32-year-old woman complains of amenorrhea since delivery of a baby 15 months previously, despite the fact that she did not breastfeed her baby. The delivery was complicated by excessive hemorrhage that required transfusion of 2.5 liters of blood. She has also been fatigued and has gained an additional 10 pounds since the baby was born. Lab data show the following. LH is 1, serum estradiol is 5, TSH is 0.1, growth hormone is 3, ACTH is 28, prolactin is 2. Injection of 500 micrograms of TRH failed to produce the expected rise in both serum TSH and prolactin. Which of the following diagnoses most likely explains the findings in this patient? So let's take a look at her hormones. LH is low, estradiol is low, TSH is low, growth hormone is low, ACTH is normal, and prolactin is low. So most of the anterior pituitary hormones are low, combined with the fact that she had excessive blood loss during her delivery, points to the direction of Sheehan syndrome. And notice she is experiencing a lot of the symptomatology associated with these hormones being low. For example, FSH and LH being low resulted in her amenorrhea, and then she's showing a lot of the hypothyroid symptoms, fatigue and gaining weight. Then what happened is they gave this TRH. Now that is a hormone that comes from the hypothalamus. Hypothalamus is right here. And the fact that it's so close to the pituitary is because the hypothalamus stimulates the pituitary. So TRH stimulates the pituitary to produce TSH. TRH stands for thyrotropin releasing hormone. But in this patient, it fails to do so because the pituitary is not functioning properly. So this all points to Sheehan syndrome, which is choice E. The husband of a 25-year-old white female consults you about his wife. 18 months ago, her last pregnancy was complicated by placental abruption, hemorrhagic shock, and the birth of a stillborn infant. She did not lactate and has not menstruated since the delivery. Since that time, she has become increasingly fatigued, apathetic, and has noticed a marked decrease in her libido. Which of the following is the most likely diagnosis? Again, a classic scenario of a woman who had a postpartum period complicated by blood loss, and several months later, she has symptoms associated with decreased hormone levels, in particular, hormones of the anterior pituitary, and that is Sheehan syndrome. But in this question, they don't actually mention the name of the syndrome, they just describe it. And you can describe it as a maternal postpartum hypopituitarism because the cells of the pituitary have become damaged or necrotic. And that would be choice B. And finally, a 32-year-old woman returns to your care 5 months after birth of her child. She had a postpartum hemorrhage following vaginal delivery of her son, requiring emergency surgery and multiple blood transfusions. She complains of fatigue, constipation, and states that her periods have not returned despite the fact that she has not been able to breastfeed. Lab tests show an FSH of 1.2, TSH of 0.3, prolactin of 1. The most likely etiology of her secondary amenorrhea is. So normal FSH is usually between 3 and 20. Normal TSH is between 0.5 and 5. And prolactin usually is below 20. So all three of these hormones are low. All three of these hormones are, of course, from the anterior pituitary, and the clinical scenario also matches that of Sheehan syndrome. Choice D.